Welcome to another edition of Talk City Greensboro, produced by GTN, featuring interviews and events happening around town. It's an easy way to stay in the know while you're on the go. Subscribe to Talk City on iTunes, Stitcher, Google Play, or SoundCloud so you can keep up with what's going on in Greensboro City government. I'm your host, Josh Johnson, and as always, today with me in the studio, not on Zoom,
Yay!
is my wonderful co-host and good friend, Rosemary Plyman.
So happy to be here. Thank you, Josh. Okay, we're going to start today with a few statistics. In 2019, 6,045 babies were born in Guilford County. 56 did not celebrate their first birthday. And 64% of these babies were African American from all socioeconomic levels. So next week, the community is going to gather for a crucial conversation about infant mortality in Guilford County. They're going to unveil data from 2020 addressing mother and baby's health needs. And Jean Workman is Executive Director of Every Baby Guilford. Welcome. Thank you for spending a little time with us today.
Well, thank you for having me.
Thanks
I'm happy to be here.
Yeah.
So what is the state of health for mothers and babies in Guilford County?
Well, the 2019 statistics are pretty compelling with regards to these disparities. And what we have found in the county of Guilford over the course of 31 years now that Every Baby Guilford's been around that length of time, those disparity rates really have remained consistent. When we were formed in 1991, the disparity rate for black infants, for instance, was 14.6 per 1,000 births, and that remained the same in 2019 when this data was collected. The 2020 data will be unveiled next week, and we're seeing some similar trends that are occurring. So a lot of work that still needs to be done with regards to a strong focus on reducing and eliminating these disparity rates.
So tell us, what are the goals of Every Baby Guilford?
Sure. Well, we're a collective action movement. We're building collaborative solutions in the community that centers and works together with all of the community to disrupt these longstanding health disparities and the racial disparities in Guilford County. We have 4 strategies that we're working on when we relaunched with this new strategic vision last June. The first one is to advance health equity by addressing systemic racism and implicit bias within the continuum of care for maternal health in maternal health settings, maternal and infant health. And we're doing that by creating opportunities for racial equity trainings within maternal health settings in particular and our maternal health stakeholders. And we've got some goals that after we have saturated the community with these race equity trainings, doing some more organizational assessments to do the now what of what do you do with this once you've learned this information and how do you apply it to policies, practices, and procedures. Yeah. We're going to also kick off with the Advancing Health Equity and Amplifying Every Voice. It's a research project, but the goal of that project is to collect the narratives of birthing people here in Guilford County with a focus of people of color, birthing people of color. And the idea being, and the hypothesis would be, in the first year of collecting these stories, we feel like there will be many with discrimination and implicit bias just because of some national trends we know about, as well as just some stories we have previously collected prior to launching Amplifying Every Voice. And the goal being, over the course of 5 years of our collective action strategic plan, we keep collecting these stories. The more race equity training, the more organizational assessments, the more work we do in that realm to advance health equity, the stories will become different and change in more positive ways. Our second goal is to center the community with a radically inclusive community engagement that creates collaborative solutions, community-centered solutions. And what this means is we really need the community involved with us. We have action teams that we're working with. We're getting ready to take those action teams to the community rather than waiting for them to come to us. We're kind of changing up some of our strategies with that. Because we want the community's voice to be a part of this, especially family voice is so vital and important because families are the ones having the babies here in Guilford County, right. Those 6,045, and we need to hear and understand and collect those narratives from those folks to help us drive this work. Our third strategy is to strengthen the continuum of reproductive care, so from before pregnancy, during pregnancy, between pregnancies, and after pregnancies, for equitable access to quality care. We're doing a number of activities with that strategy. We've just launched health ambassadors, so we have recruited individuals in the community. Some are college students, some are just young professionals. We're getting them trained in preconception health topics, and we're asking them to help us spread the word. So it's a peer-to-peer approach of being able to provide information of why taking folic acid is important, why reproductive life planning is important, why child spacing up to 18 months between pregnancies is important. So we want that driven by the community from people who look like other people in the community. And then we'll be launching what we're calling baby steps for a healthy family and future. And so we want the community to get out, and you can go to our website at everybabygilford.org and sign up to participate in baby steps by recording. It's just a matter of signing up and sign up to record your steps. We'd love by October to say, we took 1 million steps for babies in Guilford County.
Cool.
So people who are already out walking and in walking groups, running groups, and just want to record their steps with us, that would be awesome. And then our last strategy is promoting infant wellness and positive child development. And this is really to honor the many home visiting programs that exist in Guilford County. We have 11 that really impact perinatal health. And we want to amplify the work that they do every day, working daily with individuals. We also have a program within Every Baby Guilford called AdoptAMom, where we provide prenatal care to vulnerable women in our community. And so we've got a FEMUR, fetal infant mortality review, where we are beginning to look at the medical records of folks who have lost infants. And so these 4 strategies kind of are our pillars for the work that we're doing and centering the community to be a part of that work.
So when you were developing all these, are there places, I mean, maybe even other places within the country or in other countries that you look to and say, they're getting this right?
Oh, yes.
And where are those? I mean, what kinds of things are you seeing happening there? These things?
Yes. So we looked at Baltimore has an organization called Be More for Healthy Babies. Cleveland, Ohio has First Year Cleveland. Cincinnati, Ohio has Cradle Cincinnati. And when we were relaunching our organization in June, we rebranded last year with the new name and relaunching the strategic direction. I look to those organizations as my role models for the evidence-based approaches, and they were using either community action, community impact, or collective action strategies like this is, where you bring the community together around the topic and you look at the topic from a systems level approach. And all of them have named racism and tackling structural racism and implicit bias in maternal health setting as one of the strategies that they're working on. And even the activities we're mimicking are activities replicating those approaches, like the Amplifying Every Voice, collecting the narratives. Other communities across the nation have been doing similar work.
Okay. You want me to take the next one?
Yeah, number 4, yeah.
So, tell us about the AdoptAMom program.
So AdoptAMom was developed when we developed in 1991, and in the early 90s, late 80s, early 90s, our infant mortality rates were much the same as they are today. They haven't changed much, unfortunately. And one of the issues that we found in the early 1990s was the gap of access to prenatal care for people who didn't qualify for Medicaid and didn't have private health insurance. And so we created this program. It started, the health department and some community members came together, formed what we used to be the Guilford County Coalition on Infant Mortality. We relaunched last year with Every Baby Guilford. But we formed this program, AdoptAMom, to kind of fill in that gap, to be the safety net for these birthing people in our community that didn't have that access to health insurance. We contract with medical providers across the county to provide antepartum care, that prenatal care, at a reduced cost of $400. And that cost has never changed over the course of the 31 years of the program.
That's cool.
And in the height of the program, we have served over 450 women. Right now, our average is about 215 women annually. A lot of our participants are undocumented residents because they don't qualify for Medicaid or private insurance, but they need healthy, quality access to care. And we ensure that with that program.
And so what are the outcomes you're seeing from the women who are in that program?
We have solid outcomes of like 95% 90% give birth to babies who are 5.5 pounds or more, which low birth weight is considered under 5.5 pounds. The majority of our moms, like 98%, give birth at a gestational age of 37 weeks or more. So we're pleased with those outcomes. I would have to say one of the biggest positive outcomes of having a program like this in Guilford County is the links to other resources and referrals that our AdoptAMom patient coordinator is able to assist. Many of the participants are new in the United States.
Yeah.
And then new in Guilford County, and they don't know how to access a lot of different services. And she, as well as our medical interpreter, serve as strong patient advocates to make sure families feel well connected, especially during the pandemic. It's been very difficult for these families because they didn't qualify for stimulus money, didn't qualify for food stamps or unemployment. And so when significant others lost their jobs, they were really at a loss of income and surviving.
And not to mention how mobility was impacted during the pandemic. So, I mean, even just trying to find access and navigate systems just became that much more difficult.
Right, yeah. And so being able to link them to resources for food pantries, resources for transportation, it was so vital and important.
Yeah, I mean, partnerships are key to what you do. I'm hearing that. And you were talking about having voices at the table. So, and how important that is. So how are you making sure you're getting all those different voices and the right voices?
Well, for the first semester, so to speak, the last 6 months of after launching, we implemented our action teams, and we were really working with the people in our distribution list when we did our collective action strategic planning, we involved the community a great deal with some discussion series and some convenings to ensure that their voices were a part of this plan, these strategies. So we went back to those same individuals and recruited them for our action teams. What we did find during that time frame that the numbers weren't as high as compared to what we would want, and inclusive of all of the voices that we would want at the table. So starting in March, we're going to kick off what I'm calling an Infant Mortality Roadshow. And we're going to start reaching out to the faith community, our housing community, our businesses, and women's leadership groups to share information on infant mortality, as well as how they can get involved with a collective voice in the process.
Fantastic. So tell us about the crucial conversation that's happening next week.
Sure. So on February 24th from 9 to 10:30, we are hosting what I'm calling the State of Infant Mortality in Guilford County. This will be an annual event. The real purpose is to unveil the 2020 data. We're always 2 years behind in our data based on how the state does the reporting. So it's a leadership gathering. I wish it could be in person. It will be virtual. Yeah. But it's a leadership gathering and involving everyone, community members inclusive. But we want funders and policymakers, leaders, business leaders coming to the table to hear the 2020 data. We're going to re-inspire our bold goal to reduce infant mortality disparities by 50% by 2026. And we are so excited that Congresswoman Alma Adams will be coming to give a keynote address on the national focus on Black maternal health through the 2021 Momnibus Act. And share from the national platform what's happening with Black maternal health. We're going to launch a video we're very excited about showing on the impact of structural racism and implicit bias in maternal health settings, and end with a community call to action.
Okay.
So this will be an annual event we'll do every year at the first of the year. We're always on the grace of when the stats get released so that we can unveil that data. But our hope is each year that we see downward trends with the work that we're doing.
Yeah, absolutely. So, okay, so want to join the conversation? You can go to guilfordcountync.gov, search Every Baby Guilford. You can register right there. And if you miss it, it will be recorded and you can watch it later as well. Same place?
Yep.
All right. Jean, thank you so much for spending a little time with us today. We appreciate all your work and helping keeping babies healthy and moms and families too.
Yeah, families too. Yeah, thank you so much for coming.
Sounds great. Thanks.
Stay tuned in weekly by subscribing to Talk City Greensboro on iTunes, Stitcher, and Google Play. And don't forget, you can download Talk City from SoundCloud.
That is it for this week. Thank you for tuning in to Talk City. Be sure to watch GTN, your official source for news and information about the city of Greensboro. GTN is available on Spectrum Channel 13,
AT&T Uverse Channel 99,
and North State Channel 31.
GTN also streams live on Roku and the city's website at greensboro-nc.gov. Take care.
Bye-bye.